If you can't hear me, I'll
All
text you the
right, we are
questions.
live. What's that?
If you have a hard time hearing me, I'll just text the questions for you.
Yeah, just text them and I'll keep the private chat open. Okay, welcome everybody to the Egyptian edition of Fertility Fact or Fiction with Tarek, who is awake at now 3 a.m. Egypt time to facilitate the show. So I'll start taking questions. We do not have an article this week, although there was some interesting stuff that came out. So I'll share some news from around the world in the fertility world. Number one, they managed to successfully transplant ovarian tissue from one person to another and get it to function, which is super cool. So that was very neat. An allograft of ovarian tissue done by Sherman Silber's group. He's in St. Louis, and he's actually a urologist, which makes it quite interesting. But he's probably the world leader in ovarian tissue cryopreservation. So very skilled guy, very smart guy, very old guy, but obviously still at it. So very cool. There is some new information coming out on PGT. Although I have to read through the studies, there are some studies saying it may not be that helpful in some circumstances, but then it is helpful in other circumstances. So that was kind of interesting to look at as well. And I think there was another study that I need to dive into as well, talking about whether or not progesterone duration alters the outcome for day 5 versus day 6 embryos. Now, years ago, we had a show, and it's on our YouTube channel, showing that if you have a day 5 embryo, it can be transferred after 5 or 6 days of progesterone. So on day 6 or day 7. But if you had a day 6 embryo, you wanted that one done after six days of progesterone, so on day 7. And this new study that's coming out basically says the exact same thing. So I'm glad that that's still true and looks very good. So excited about that. And so yeah, some interesting stuff around the corner. Not necessarily ready for prime time yet, but we'll have a look at that. I did record a video, Tarek, you would have died laughing, today on questions about sperm. So that'll be coming out on TikTok likely very soon. It was quite funny, sort of the ins and outs of sperm. So I thought that was kind of hilarious. And yeah, that's pretty much about it so far. And our busy season starts soon. We're traveling quite a bit. Our St. Catharines clinic opens up end of the month. So excited about that. And Woodstock should open up shortly after. Yeah. Tarek, how's Egypt, buddy?
Hot. It is extremely hot here.
It's extremely hot there. All right. Okay, we got some questions. So I can spare you the grief and I'll read them myself. From Jana, who's awake way too late in the middle of the night. Jana, go to bed. Help. 50 units Gonalef for FET only made my lead follicle grow like crazy, but my lining didn't react. What's wrong? Estrase and Viagra don't work either. What else can I do? Jana, at this point, the only thing I can tell you, dear, is you probably need to come here so I can figure it out. I don't know what else it would be. Usually the Gonalef would work, although we typically use 75 units a day, not 50, so maybe a little bit more. And it could be that your lining is recovering from what just recently happened for you. So that's probably the most likely factor. How much oral or transdermal estrogen supplementation hinders follicle growth? You need a fair bit of estrogen to hinder natural follicle growth, but it won't necessarily hinder follicle growth with Gonalef. Do you want to ask the question, Steve, or do you want me to?
Yeah, no, absolutely. I can ask some questions for you.
Okay, go for it.
Hi, Dr. Victory. Would you be able to tell an endometrioma from a hemorrhagic cyst on the ultrasound? Is it possible for an endometrioma to grow from 3 centimeters to 7 centimeters in 2 weeks? Or is this more likely a cyst?
I've never seen an endometrioma grow that quickly, so that's probably not that likely. I would suspect that that's not realistic. It's probably more of a hemorrhagic cyst or just a cyst. I guess it's possible, but that would be pretty unlikely. And how do we tell? We can tell. You can tell the difference between, an endometrioma and a hemorrhagic cyst on ultrasound. The features are different. Endometriomas have this appearance that's classified as a snowstorm because it looks like you're walking into a snowstorm. Hemorrhagic cysts are a bit more dense than that. And endometriomas fill the whole cyst. Hemorrhagic cysts tend to level out after a few days. So they are different. They don't look exactly the same.
From Instagram, do you prescribe doxycycline right before an FET?
We prescribe azithromycin before an FET, so similar. Yep.
Can you explain why preeclampsia is a risk factor for IVF?
Well, probably for several reasons. Number one, it's not a totally normal implantation. Number two, many people are doing fresh embryo transfers or hormone replacement embryo transfers. And because there's so much estrogen there, it reduces the chances of implantation. And then on top of that, when it does implant, the vascularity is different. So it definitely messes up the chances that you'll have a normal implantation. And as a result of that, the preeclampsia rate's higher. Further to that is the reality that you're dealing often with patients that have either vascular diseases or maybe weight as a factor. And so those also can contribute to an increased risk of preeclampsia. We know that if you take aspirin before you even start, you will reduce your risk of preeclampsia. So there is good treatment for it now, but that's important.
Doctor prescribed birth control pills along with Lupron and letrozole to help combat side effects. Thoughts. Also, could sprinol,
Spironolactone.
there you go, be added before
Yeah.
Lupron or letrozole?
So I love Amy and we're friends. I can't say that I agree with that. So the whole idea behind taking Lupron and letrozole is to reduce the estrogen level to negligible, and taking birth control pill has been proven to negate the impact of taking the Lupron. So we would never advocate for that. No, I can't say that that would make sense. Spironolactone, I guess in theory you could. My question would be, why would you? Spironolactone's for PCOS patients. It's not helpful for endo patients. So why would you be on spironolactone if you're dealing with endo? Unless you have PCO and endo at the same time. But the Lupron is going to shut down everything, so the spironolactone would be unnecessary.
Can you speak to severe DOR if undetectable, like AMH less than 0.01?
Say that again. I couldn't quite hear you.
Yeah, no problem. Can you speak to severe DOR if undetectable, like AMH is less than 0.01?
Well, I mean, it doesn't eliminate your chances. It just makes it extremely difficult. Strategies that have been tried and have shown some success: DHEA, testosterone priming, human growth hormone priming, ovarian PRP, or just natural cycle IVF if you're still ovulating. So there are still options, including non-IVF options, but they're definitely more difficult for sure.
Hi, bestie. I had an ultrasound last week. She was fine. I just can't find it with a Doppler.
Well, don't panic if you can't find it with the Doppler. That's fine. It's hard to find it with the Doppler, so don't panic.
Could you please tell me how long the IUI process takes from the initial consultation?
Well, from initial consultation, we usually need to do testing. So that often takes, a couple of weeks, maybe months. And then you're ready to go for your IUI after that.
Two-part question here. How to differentiate between IBS or endo? I've always thought IBS, but could it be endo? I've had poor egg quality, 39. Could IBS affect that for retrievals?
To the best of my knowledge, IBS does not have any impact on fertility whatsoever. How can you distinguish? I mean, IBS shouldn't be any worse during your period time. And IBS doesn't typically cause pain during intercourse. Endometriosis does. So those would be some key ones. Do you want me to grab one here? I can see a Facebook question. How much does it cost to take your
Sure.
clamps off? They say clamps. does it take to take your clamps off? So I think right now we're charging about 8,000 Canadian to do a tubal reversal. Are you seeing the YouTube questions?
Yeah. Hi, Dr. VNT, Dr. T. Can high NKT cells, that is CD3 plus 56 plus and CD19 plus 5 plus cytotoxicity B cells impact pregnancy?
Yeah, I mean, if you believe the literature on that, it suggests that it increases the risks of miscarriage. Yeah.
Have you worked with surrogates?
I work with surrogates all the time. We have the second largest surrogacy egg donor program in Canada. So, yeah, we do it night and day.
What surrogacy agencies do you recommend?
They're on our website. We'll work with anybody. There are some we recommend, but we'll work with everybody. So just check out our website. It's all right there. Go on our website and scroll over to go to infertility and then go onto the kind of menu, and it's off to the right. And then it'll say surrogates, gestational carriers. Just click on that. We have Canadian. We're updating our American one, which reminds me, T, I need you to update the American ones that we had talked about. So add those in there. And then we'll have some Mexican ones in there soon as well.
Hi, Dr. VNT. How important is the placement of an embryo during an FET? If it matters, what makes it a good or bad placement?
How much does it matter? It's everything. So appropriate placement can really make the difference between success and failure. So it's critical to get it right. What makes a good placement? You really want it in the center of the kind of widest part of the endometrium. So every uterus is different. Like there are studies that say 1.5 centimeters. I personally think that's way too far away. We typically aim for 0.75 centimeters, but we adjust from patient to patient. So I had a patient today where I did more like 0.5, 0.6, and I had another one where we did 1 centimeter.
Do you recommend PGTA testing 3 or less embryos if you have stage 4 endo and are a poor responder?
Yeah, I saw that question on YouTube today. And I answered it actually. So the studies actually say you probably shouldn't, but it's only one study by someone that's biased against PGT. So, I mean, it really depends on what your plans are with regards to the embryos. Like the reality is that the PGT is probably embryo harmless and will likely be beneficial in terms of helping you select better embryos so that you know which ones to transfer and which ones not to. Is there a chance that you're going to get a false, positive answer, meaning it's going to tell you your embryo is abnormal when it isn't? Yes, but that chance is extremely, extremely, extremely low. So realistically, you are probably better off getting the PGT done. Having said that, with a very low number of embryos, depending on how many you're transferring, arguably, if you're going to do 2 at once and then the third one on its own, you could do whatever you want.
Can you explain why IVF is a risk factor for, oh, we did that. Hello, would you 100% recommend that we postpone IVF if my AFC is at 5 at day 2?
No, I don't know anything about you, so I'd need to know way more. I mean, if your AFC is normally 5, no. If your AFC is normally 20 and it's only 5, yes, of course I would.
How important or impactful is your diet months prior to an FET?
Critical.
There you go. How can you test cervical stenosis to be the cause of infertility?
How can you test cervical stenosis? When we do our saline infusion sonohystogram, which should be part of every fertility workup, we pass a catheter through the cervix and we know if it's tight at that point. I got to answer, Jonna. Thank you. 75 units will make the follicle grow even faster while lining is still thin. Is it possible to slow the follicle growth with estrogen and synchronize with lining growth? I guess you could start with estrogen, Jenna, and then add in the FSH later. That's a reasonable approach. Okay, go ahead.
Yep. If you had low LADs other than lit, what do you recommend?
IVIG or subcutaneous IG?
I did a donor egg IVF and used a euploid. I am now 9.5 weeks. What's miscarriage chances at this point? I love that I did a modified natural.
Congrats on behalf of all of us. Go you. It's less than 2%. If you've seen a heartbeat, it's less than 2%.
Go for an FET. 5 failed FET, PGT normal and immune protocol, plus your endo protocol. Benefits to surgery versus suppression.
Our endo protocol is awesome and it really makes a huge difference for people, but it is not as good as surgery. I mean, you're trying to minimize the inflammation, and removing the endo is the best way to minimize the inflammation. You can't get that unless you operate.
What does it mean if on day 3 embryo is 12 cells?
That's a pretty fast growing embryo. That's okay. It could be a really robust embryo. T? Hello. Oh, we lost D for some reason. Okay, I'll ask some questions in the meantime. Let me go back down here. Can we take low dose naltrexone for high NK cells and high Th1, Th2? If yes, how much? Yeah, so I had someone review this for me because my last read of it showed that it did nothing. I still have not found any valuable evidence to demonstrate any utility for low dose naltrexone. There are no good studies. So I'm still not a believer. I'll become a believer when somebody shows me a good study. If any of you have a good study, put it in the chat. I would love to see it, but I could not find any during a search. Can you add low dose naltrexone after transfer? Again, useless, so I don't do it. Do I ever prime an endo patient for an egg retrieval with norethindrome? Never, nor would I. If you're going to prime an endo patient for an egg retrieval, the only drug that's been shown to be beneficial from a progesterone perspective is to use Vizan. So that's helpful, but none of the others. T, are you back?
I am back.
Oh, I don't know what happened to you. Did you pass out or something?
No. It's just the internet here is, for whatever random reason, fades
It's shady.
and comes back.
All right.
Yeah, absolutely.
I'm on Rose here.
Actually,
I
and
know
welcome
you
back,
use
Pete.
Lupron as part of your transfer protocol. Is this usually the Lupron depot? I'm a PCOS and male factor patient. Yes, we use a 3.75 milligram Lupron depot dose, Rose. Yep, and that's what the research showed. Go ahead, if you're there.
Okay. Hey, Dr. V, just did my beta results yesterday. My number was almost 19,000. Life cycle was June 24. No idea when I ovulated. Do you know how many weeks I would be? Also, when would I have my first US ultrasound?
Cassie, congratulations. If your last cycle was June 24th for your first day, right now you'd basically be somewhere around, what's the date today? It's the 13th. So you'd roughly be about 7.5, 8 weeks. So yeah, I mean, that's a reasonable time to 7.5 weeks. So that's a reasonable time to go for your first ultrasound. There's a YouTube,
Does
2
having
YouTubes
cancer,
before that.
go ahead.
No, go ahead.
Okay. Does having cancer in your 20s affect the ability to have babies in your 30s?
Oh, great question. Depends on what kind of cancer and what kind of treatment you had. If you had chemo or radiation and it was to the pelvis, yes, for the radiation. If not, then likely no. I mean, it would depend on what kind of cancer. If you had a skin cancer and they removed it, no, of course not. But if you had like, Ewing sarcoma and they gave you radiation and chemo and it hit your pelvis, yeah.
Do you work with patients who have mitochondrial disorders?
We work with all patients. Mitochondrial disorders are very complicated, but you can rule them out in patients by using PGT-M. So it depends on what's going on, but yes, we work with everybody.
When would you suggest
Non-discriminatory.
assisted hatching?
When? Well, we use it for everybody, but the studies say you should use it for older women, recurrent failures, and women with thick zonas. We just use it for everyone. Everyone gets assisted hatching. It's part of our protocol.
Hi, doctors. Lads didn't improve after 2 lits. My doctor suggested to do a pooled donor lit with partner. Can we avoid partner or is it mandatory?
I don't know why it would be mandatory. So yes, you could avoid partner. I guess my question would be, is it going to help you being with your partner? It won't hurt, but I don't know that it would help.
Um, what would be the reason one test says positive and one says negative?
I don't know what question that is. Like, what are they asking about?
I
That's
think a
from
pregnancy
Chante.
test.
I'm
Yeah.
assuming pregnancy test. I mean, could be quality of the test, could be your beta HCG levels, could be when you took it, how you took it. There's a million different answers to that. Good question, but very hard to know. And it depends on what test you're referring to.
I checked everything like AMH, prolactin, LH, sonography, Terriens, bad trans, virginal ultrasound, but everything is normal. Then also, I'm not getting pregnant. My period is irregular and getting black like blood. Please, could you tell me what is the problem?
Well, it sounds like you have PCOS if you have irregular periods, so that's the problem. But I would need to see you. I can't tell you from a YouTube question like that. I need to see you to understand. So, Stephen Bowl, is that Stephen Bowl that I know from a million years ago?
For someone at the bottom of your IVF funding list, how long will it take to get a funded cycle?
At the earliest, April of next year. That's at the earliest.
From TikTok, do you believe in three-person IVF for mitochondrial disorder patients?
Um, it's not legal here. It's only legal in the UK. So, do I believe in it? I mean, it's irrelevant if I believe in it because I can't offer it here. Um, so, it's interesting. If you're talking about a true mitochondrial disorder, like a disease, sure, it makes sense. If you're talking about mitochondrial dysfunction, like let's get somebody else's mitochondria and enter them into the eggs of women that have poor quality eggs, there is no good proof that that works well. So I would be very reluctant to do that. It would be experimental, and for someone desperate, it's an acceptable thing to try, but it's not like clear that that works very well.
How long you have to be on progesterone oil after a positive pregnancy?
We keep our patients on it for 12 weeks. Some people stop at 6, some people go to 8, 10, 12. We just go straight through to 12.
Good evening, Dr. Victory, and welcome back. T. Thanks. HX of a chemical, REI recommending vaginal progesterone and aspirin, 7-DO prog 21 indicated cycle with trigger. What is your practice on this?
You broke up a lot there, buddy.
Oh, sorry.
We would continue aspirin. We would have started it already, and we continue prog. So, I mean, our practice would be to continue those.
Dr. V, what do you think of doubling but lower end numbers?
It's doubling, but the numbers are lower.
Yeah, lower end numbers.
I mean, as long as it's doubling, there's still a chance. So I wouldn't mess with that. It would depend on how much the HCG levels were. But remember that early on, the numbers are low and they don't actually double at the very, very beginning. And then later it slows down. So it all depends on where your numbers are. And it also depends on your age. People forget this all the time, but older women have lower HCG numbers. So that's an important part to remember also.
Do you recommend NIPT if pregnant from euploid embryo? Had the general ultrasound and blood work, but wondering if paying for NIPT is worth it.
I don't think it's worth it, but lots of people want to do it just to make sure that it's perfect.
Why does our embryos die after day 3?
Well, if it's after day 3, it's often going to be the fault of the sperm. Poor sperm quality can lead to embryo failure after day 3. So that would be the first thing we'd look at. Could still be egg quality, could be the lab, but typically it's from sperm quality.
PGTA day 5 BB embryo transferred. Beta's good and doubling. Last beta 19 days past transfer was 12,900. Chances that ultrasound will be okay. First FET was blighted ovum, worried it'll happen again.
I can't answer the chances it'll be normal. That's impossible. It depends on who you did it with, where you did it, their success rates, how many embryos they transferred, and so on. But I mean, that all sounds very, very promising. So I would be very positive about it and would not be worried. But I can't give you numbers. It's impossible to know.
During the IVF process, I think the gynecologist noticed endometriosis in her system instead of him to terminate the project and look for a solution. He decided to still continue with the process. Please, my wife has endometriosis, which was noticed during her IVF process. The eggs did not do well. What drugs can be used to bypass the endometriosis to have a good egg?
You can't bypass endometriosis. If you've got bad endo, you either need surgery or you need medications to try and suppress the endo. And you would need a whole consult. Like I need to know about her history to advise, but there are medications that people have tried. I don't know if it's right for you or not, but like things like Vizan, Lupron and Letrozole, rapamycin, there are a number of different things people use, which has been shown to be beneficial, but I need to know your wife's history personally to know if it's appropriate or not.
Is it okay to take out a tooth? I'm 6 months pregnant.
Ideally, no. When you do anything in the mouth, it involves a lot of bacteria, and that bacteria can then cause significant problems with going into your bloodstream and then getting to the baby. Once it's at the baby, you're going to end up delivering from preterm labor. So we try to avoid removing teeth or significant dental work in pregnancy if we can. Some people have to, but you got to be careful.
Senior Hawk Tool video, LOL. Thoughts on pre-seed lubricants?
Pre-seed lubricant is the best of the lubricants that are currently available. And you suddenly got a lot louder, which is good.
That's great. The internet here is far from great.
As old as the
Um,
pyramids.
it's not a invalid statement for sure. Um, Top vitamins for PCOS and conceiving.
Um, Depends on whether you're in a normal or not normal weight category. So we have a three-pronged approach. We do Lupron plus minus not Lupron, Letrozole plus minus metformin. We do 5 natural supplements: NAC, inositol, coenzyme Q10, resveratrol, ALA, and then we make sure they're on an appropriate diet. So 6 meals a day: breakfast, snack, lunch, snack, dinner, snack, and we do uh, muscle building exercise or HIIT training. Combined all together, that's a very useful way to go about treating your PCOS, and it seems to work very, very well.
Dr. V, you're going to be doing my luteal review. When would you recommend I start priming before stims? I forgot to ask earlier today.
Day one, cycle
Can
day
you
one,
remind oh,
roughly that long before, like 2 weeks before we start stimming you.
can you remind us if and why it benefits high NK cells?
Because by sensitizing you to the partner's proteins, in theory, it should reduce your immunoreactivity and your immune system calms down. That's the theory behind it.
How much progesterone is advised post a fresh day 3 fresh transfer?
you still want your levels to be optimized. So in Canadian units, between 40 and 100.
Hey, Dr. V, what can I do to help with implantation, PCOS?
That's a really broad question. So, um, vitamins, supplements, ovarian PRP, lining thickness perfection, letrozole protocol, Lupron before, um, exercise, appropriate diet, weight loss if weight's high, no smoking, no drinking, no drug use, tons and tons of vitamin D. I mean, I could go on forever. There's a million things you can do.
I've been wanting to go on letrozole. What fertility doctors recommend? That's all I got.
I've been wanting to go on letrozole. What fertility doctors recommend? I'm not sure I understand that. We use
I've
5
been
mil.
wanting to go on letrozole. What do fertility doctors recommend?
We use 5 milligrams from day 3 to 7 for a frozen embryo transfer or for just getting pregnant on your own.
Hey, my favorite. Hey, my favorite docs. You said in not to use Lupron for IVF. Is that before transfer or before retrieval?
Before retrieval. Yeah, and before transfer, if you're doing suppression, like 3 months of Lupron for endo patients alone, it's not useful. But 1 month of Lupron for the general population is beneficial.
I've had 8 miscarriages. I'm pregnant again. Can I have a healthy pregnancy history of endo?
Can you? I don't know. I'd need to know your history, but probably. I mean, there's very few people we can't actually help. So I would need to know your full history. Why did you miscarry? What's your health like? What's the sperm health like? At what time did you miscarry? What were you on? What have you tried? What have you not tried? Has there been aspirin, heparin, progesterone? Have you done a microbiome test? Have you looked at your immune system? All of these things would be kind of critical to figure out.
5 failed Clomid and letrozole cycles together. Why does it keep failing? PCOS, no other factors, even up to 4 mature follicles in a cycle.
Could be endo, could be poor sperm quality, could be problems with your fallopian tubes, shape of your uterus, quality of the sperm when they're doing it. Smoking, drinking, weight could be a factor, low vitamins. I mean, there's a million different reasons for why it would fail.
Hi, doctor. I was spotting a few days before my FET on a natural modified protocol and for a week after FET. Is this due to lower progesterone or too much prog? My baseline prog on the next cycle was 12.
Spotting we normally think is related to a structural problem, like a polyp or a fibroid. So that would be the first thing I would want to look at. But otherwise, I'd be looking for something like, your progesterone levels and your estrogen levels and your thyroid and your prolactin. Like we would do a total exam to figure it out.
Hi, doctor. What is the success rate of a hysteroscopic?
Success rate is going to be surgeon dependent. And it's also very much going to depend on sort of, how it's done and what it's done for. If you're talking about minimizing fluid in the uterus, it's generally very successful. If you're talking about managing the shape, it's probably going to be very successful. If you're talking about how successful it is in terms of improving implantation, I mean, that totally depends on the severity of the isthmial repair and the surgeon that's repairing it.
Dr. V, could you please talk about treatment options and outcomes for cervical stenosis?
Well, there's only one treatment well, I guess I shouldn't say that. There's 3 treatment options. Excuse me. So you could do cervical dilation, which has a very good success rate. I just did that for a colleague of mine who immediately got pregnant right after, so that was great. You can do it for someone with insemination. So you can just bypass the cervical stenosis, or you can do IVF and do an embryo transfer.
Hi, Doc. Hi, Doc VNT. How can someone fix low T3 levels and extremely high reverse T3 during pregnancy? Would T3 meds help of free T4 is almost optimal, or both T3 and T4 meds are needed? Thanks a mil.
Usually you don't need them both because pregnancy is different, but I mean, depending on how bad your levels are, I would send you to an endocrinologist. You could take Cytomel, which is T3. So that's a possibility.
My anxiety needs you to address the folic acid versus folate acid thing that I keep seeing on TikTok. So many doctors are saying it doesn't matter on MTHFR.
No, that's not true. So MTHFR people have a problem processing folate. So they need methylfolinic acid, which is different from folate. So it does make a difference. You can't process the folate properly. And actually, someone earlier said, "Hi, Doc V. I'm homozygous for 677T. Already tried 2-baby aspirin and Lovenox and progesterone, and it didn't work. What should the next step be after 5 recurrent miscarriages?" That's not the problem if you've had 5 recurrent miscarriages and you're on aspirin and heparin. So I would do a consult with us and figure out what's wrong. We would do additional testing to sort it out for you. Yeah.
And she followed up with the question about what do you like TSH to be under for a FET?
Less than 2.5 is what's recommended.
What is success? What is the success rate for an FET for AA but not genetically tested?
Oh, there's no way to answer that. I mean, I need to know so many details about you, right? 4AA is a fabulous embryo, but is it a 4AA from a 25-year-old? You probably have an 80% chance. Is it a 4AA from a 45-year-old? It probably has a 10% chance or a 5% chance. So, your weight, your health, your protocol, the sperm quality, like there's so many factors. I can't answer questions like that, guys. Yeah.
Hey, Dr. VNT, for low AMH, high FSH luteal retrievals, would you recommend priming day 1, then stim?
Sorry, ask that again. I thought I understood that, but then I didn't.
Hey, Dr. VNT, for low AMH, high FSH luteal retrieval, would you recommend priming day 1, then
Oh,
stim?
yes. Yeah. Prime day 1 and then stim in the luteal phase. Yep. That's what I said.
Excision lapse, yeah. Excision lapse surgery, and the doctor said a nodule was removed from my bladder and colon. What is a nodule?
It's like a clump of endometriosis that's buried itself in there and then formed like a bit of scarring around it. So it's firm and it's hard. And you got to dig out the whole nodule. If they
Best FET
removed it from,
protocol.
if they removed it from your colon, you had bowel surgery. That's very uncommon, but I guess it's possible. Best what protocol?
Best FET protocol, 39 regular periods, IBS, 0 preg, traveling to Ontario, 1 euploid, terrified to fail.
Lupron, letrozole, lots of vitamins, melatonin, coenzyme Q10, vitamin D, fish oils, prenatal. If you only have 1 embryo, we would definitely want you to do your fertility testing. Get that all sorted out. We do use antibiotics frequently, lots of probiotics, and then double progesterone and go for it. And a good embryo transfer, obviously.
How does an ectopic pregnancy affect the future fertility?
Depending on how far it goes or how it's treated, it can damage the fallopian tube, and the fallopian tube is necessary for the eggs to make it through. So if you don't have a properly functioning fallopian tube, you're at risk for another ectopic.
What brand of prenatals do you recommend?
There's lots of different prenatals. We don't support one over another. Pregvite Folic 5 probably has the best complement of everything you need in it, but there's NFH, SAP prenatal, there's Centrum, there's Materna, which are literally the same thing. There is all sorts of different ones, Jameson, here, there, everywhere. So there's lots of different ones. Yad has a product, so I don't push one over the other. We typically use a lot of Folic 5, but everybody's different.
What do you like the TSH to be under for FET?
We answered that one, 2.5.
Hi, Dr. V. My HCG was 9 days post-transfer. Would this be considered complete failure or chemical?
No one should be testing 9 days post-transfer. It's admittedly a little low, but the test isn't sensitive enough to detect that level. So I would ignore that for now and wait.
Is there any benefit to using the HCG wash at the exact same time as the FET embryo placement immediately following wash? No wait at all.
The studies that we've reviewed, and we had one that was a meta-analysis. It was from Iran, and we reviewed it on the show several years ago. Showed that you need 15 minutes between the time that you do the HCG wash and the transfer. So that's what we've always done. We've always done 15 minutes.
Seeing naturopath, day 20 estrogen was very high, so he gave prescription for progesterone topically from day 14 to 28, and period was spotting for 3 days starting day 35, then full period day 46. Will doing this, that's about it. That's it. No idea.
No
Will
idea.
doing this is how it ends. Yeah.
Yeah. Let me ask
How about
Niha's. Let me answer Niha's question because she's asked it about 50 times. So your age is 25. You have one tube. Is there still a chance you can get pregnant? Yes, there is always a chance you can get pregnant. Depends on why you only have one tube. I know you said you have endometriosis. Depends on how bad the damage is to the other one. It depends on the condition of the other one. There's a lot that goes into it. So again, I can't answer personalized questions because it's impossible, but there is a chance. With regards to which supplements for endo, it's NAC, curcumin, resveratrol, ALA, and coenzyme Q10. And then we also use prenatal vitamin D, melatonin, and the fish oils.
top vitamins for PCOS and conceiving?
Exactly the same ones I just mentioned, except we would switch out curcumin and put in inositol instead. So it's NAC, inositol, coenzyme Q10, resveratrol, ALA, prenatal fish oils, vitamin D, and that's everything you need. Melatonin
My
helps.
age is 25. My age is 25 and only one fallopian tube. How much chance is there to get pregnant?
That's the one I just answered a moment
Oh,
ago.
okay.
That's Nia from Nigeria. She's watching from
Uh,
Nigeria.
hi, doc. Hi, doc. Hi, Dr. V. I'm homozygous for 677T. Already tried 2 baby aspirins plus Lovenox plus
I did that
progesterone.
one.
Okay.
Yeah.
Is hair dye negatively impactful prior to the retrieval and or transfer process?
Yes, it's your scalp is very absorbent, so anything you put on your scalp will seep through. So don't do that.
Dr. V, how long after immunotherapy for melanoma can I try to conceive again?
Oh, good question. I think it would depend on which immunotherapy you used. So you'd need to know what the half life was. So talk to your doctor and figure that out. But it would all depend on which one you're using.
What are the best natural, over-the-counter, or foods to increase sperm count, motility, and quality? And what to avoid? And is aspartame really bad for male infertility?
Aspartame is terrible for everything. Foods to avoid anything fatty or sugary. The more vegetables and fruits and stuff you have, the better off you are, and more of a healthy Mediterranean type diet. With regards to things that can potentiate your sperm, I've never read anything diet specific, but we know that anything high in zinc, folic acid, coenzyme Q10, that kind of thing, that'll all help. So anything high in those would be helpful for you.
What is the ideal FSH increase per day while doing IVF stimulations such that egg grows 1 millimeter per day?
No one monitors FSH levels while they're doing IVF, so I don't have an answer for that question. And if they are, you should be going to a different clinic. No one does that. Yeah.
7 years married, TTC for 5 years. A few years ago, my previous gynae put me on multiple cycles of Clomid. I gained weight and PCOS in my recent scans. Could that have been because of the Clomid?
No, 100% not. Absolutely not. PCOS
Would
makes
you
you,
ever
the Clomid tries to counteract it, but it certainly would never give you PCOS or make you gain weight.
would you ever do a fresh transfer in post-op stage 4 endo patients? Doctor said at low risk of OHSS due to low egg count and chances of success is the same as frozen transfer.
No, because I disagree, and the chances are not the same as a frozen transfer. You're still going to have the immune system overactive, and you would benefit from an endo protocol, and you can't do an endo protocol with a fresh transfer. So I would never do that. That's just us.
Any clinics you can recommend in the US? The doctors and fertility clinics I've been to don't treat recurrent miscarriage.
Um, there are some good doctors in the US. Um, the good ones are either a very long wait or they're very expensive. There's Dr. Amy Avazadeh. She's a bright lady. She does a good job. And there's Eve Feinberg, who I also very, very much trust. She's brilliant, but she's like so busy you can't even get into her. Um, those are probably the two best I know of in the States.
Why does the US have such a different pain treatment method for egg retrieval than Canada?
Um, Well, in the States, the regulations for provision of propofol are very different than they are in Canada. So in the States, they put everybody to sleep during the egg retrieval, which definitely has some advantages. Don't get me wrong. I think it's great. We're allowed to do it in Canada. The problem is you actually have to have an on-site anesthetist to do it here. And then we could do it, but we'd have to massively jack up the cost because you'd have to pay for the anesthetist. You need a whole anesthetic machine. You need a whole other level of approval, and more equipment and more staff. Like our cost would probably be an extra, I'm guessing, $3,000 or $4,000 per case if we had, full sleep. I will tell you that our reputation here is exceptional for making sure the patients are comfortable. And we make sure our patients are extremely comfortable the whole time. So it's very, very, very rare that someone will tell us that they were having a lot of pain. It happens, but it's extremely, extremely rare for us. Most of our patients say, I felt nothing. Like when we wake them up and say, okay, it's time to get up, they go, what? You're done? Like they don't even know. Yeah.
What is a good amount of eggs to retrieve for a 32-year-old?
A good amount, 20, 25. That would be awesome. Reasonable, 15. Low, 8 or less.
Are you super fertile 8 months after having a baby or same statistics like before?
Um, it depends on whether or not you're breastfeeding and what kind of delivery you had and what happened to your weight and lots of other things. So it's hard to answer that, but you're certainly not super fertile. No.
One of our embryos reached blastocyst on day 6, but genetics said it was not good for freezing, as it was not formed properly. Is this an egg issue?
Not necessarily, and I don't know what they meant for it was not good for freezing. They may have meant the quality of the embryo wasn't good, so that could be sperm, that could be egg, it could be the lab. So it's hard to know.
Doctor, my first IVF process just failed because out of 7 eggs, only 3 eggs were good, but letter got bad. This was just last week, Friday. How long can I wait before doing the process again?
A month, you can retry in 1 month. Ashu is like adamant, eh? 1 minute after she
Yeah.
30 seconds after she asked again. Wow. And it's like middle of the night
We're
in
coming
Nigeria.
there.
I think they're 7 hours ahead of us. So that's interesting.
It's a big show. It's a
It's
big
a big
show.
show. All right.
Thank you so much for this weekly space that you save for us. Your thoughts about intravariant stem cells?
I mean, it's like PRP. There is some evidence weak that it's beneficial. The more I do PRP, the more I feel that it's only suitable for some people and not everybody. So I'm reluctant to tell everyone to come piling in here and do PRP. Like, don't get me wrong, it's good for some people, but I think the hype is hype. I'm not convinced yet that it works that well.
Thyroid levels are 2.6, starting FAT in a month, already on thyroid medication. Should the dosage already be increased now? Doc wants to retest on day 2 of the cycle next month and adjust if needed.
Um, no, I mean, I'm comfortable with the 2.6. I probably wouldn't. Apparently, you missed Dorcas's question. Oh, there it is.
Okay.
I got it. Do you want me to ask it?
Sure, go ahead.
I just did TSH reflex to T4 and it's 3.1. The range is 0.45 to 4. Does it mean mine is high if you're saying less than 2.5? Yes, yours is higher than it should be, ideally. It's not bad, but it's supposed to be minimum less than 3, ideally less than 2.5. There you go. Quick question answered.
Besides sperm analysis and DNA fragmentation, what other tests are available that you would recommend?
For sperm, there's something called meioxis, which tells you the amount of oxidative stress in the sperm. You can do sperm aneuploidy testing to see what percentage of the sperm are aneuploid. Basic and advanced semen analysis, short-term and long-term survival. All of these are things we would look at.
Had a positive Receptiva DX test. No signs of endo. What next step should I consider? Nothing, Lupron, surgery. My doc's just doing nothing to go ahead with only one PGT embryo left.
Oh, wow. Okay, so first of all, I'm not a believer in Receptiva, so let me start with that. Number two, if you're worried you have endo and if you only have one embryo left, I'd go for a lap. And then number three, I would do fertility testing. I mean, our success rates with fertility are unbelievable. So I would want to test to see what's wrong and then address what's wrong before you transfer your last embryo. Good question. That's a great.
Is testosterone for HGH for DOR endo patient okay?
Yes, we do that all the time, routinely.
Somebody thinks their question was missed. Maybe it was. Maybe it was.
No, that's the one I asked.
Oh, okay, great.
Yeah.
Would you proceed with an FET in a cycle that menses were usually heavy and long, no particular diagnosis?
As long as your lining responds, sure.
Do you recommend intercourse the day before an FET?
100% proven to be beneficial.
Is it possible to be genetically incompatible with euploid embryos created from donor egg or sperm? If so, how do you test or account for this? And is there a protocol to correct, or are embryos useless?
No, there's testing. So Fertilis or other companies can do the tests. They can definitely test for you and find out if you're a mismatch. You may need your donor's blood, which would be difficult if it was sperm, easier if it's an egg donor. But it is possible to find out. And you can certainly screen yourself to see if you're a problem. If you don't truly know, you could try various therapies without knowing. Some of them are easy, some are really expensive and not so easy. So it depends on what you want to do.
If a 43 age woman is only making a single follicle, is stem cell PRP advised?
No, because at that age, you need a ton of eggs to get a genetically normal embryo, and doing it is only going to make you make another extra 1 or 2 eggs, and you need way, way more than that, like 10 times that. So I don't believe in those cases it's worth it. I think people are getting scammed. And there's one particular clinic in the US dragging women in and saying, oh no, I do it differently and mine's much better. And I got this other thing which involves a special type of sauna. Yeah, I mean, there's zero proof that they're any better than anyone else. Zero. In fact, I'm very tempted to go on SART and see what their success rates are. Maybe we should do that. Yeah, that would be fun.
For someone looking to donate eggs, can the fertility screening be completed with an IUD in, or does it need to be removed first?
That's a great question. So if it's a copper IUD, of course you can. If it's a non-copper IUD, like a Mirena IUD, you can do the screening for it. But the problem is that we don't always get an accurate representation of how strong your ovaries are. Some women react more strongly to the IUD, some women not as much. So we like it when it's out, but it's not a deal breaker. We will test you with it in. If you test poorly, you can always take it out.
PGTA day 5 BB embryo transferred, beta's good and doubling. Last beta 19 days past transfer was 12,900. Chances that the ultrasound will be okay. First FET was blighted ovum. Worried it'll happen
We
again.
answered that one way
We
earlier
did
in the
answer,
show.
yeah.
Yeah. It's a good
Um,
chance it's going to be normal. I can't tell you what the chance is, but it's a good chance it'll be normal.
should endo patients completely cut out dairy and gluten?
No, absolutely not. In fact, we've reviewed evidence on a prior show that demonstrated that endo patients actually do better with dairy. I don't believe in elimination diets. They make no sense. Don't go on elimination diets.
In Europe, they use the medication Prolutex instead of a PIO shot, not
Yeah.
approved, not FDA approved. Can I use this medication in my protocol instead of PIO or not mess with this because if the doc has no experience with meds?
I mean, in the head-to-head trials, supposedly it's just as good. So you could use it as a substitute for the PIO. Can I answer a quick one here from
Yep.
YouTube? Cam V,
Mhm.
hi Dr. V, 27-year-old PCOS, 12 follicles on day 6 of stims. Do these look like good numbers? Thank you. To be honest with you, if you're 27 and you have PCOS and there's only 12 follicles, no. I mean, that would be concerning for me. That doesn't even make sense. So I'd be wondering why you only have 12. If you're PCOS 27, you're probably capable of making 25 eggs. So I guess I'd want to know why they are only making you make 12. And Dorcas
Fertility.
asked, what do I suggest? See your family doc. You can get thyroid supplementation for your thyroid from your family doc, Dorcas. So if you're waiting to see me, just talk to your family doc. And we'll be seeing you soon anyway. So that's fine too.
How does melatonin help for an FET?
We don't know, but the theory is probably related to sleep. We know that your sleep hygiene, your sleep habits are very important for your quality of your FET and the outcome of your FET, and for your hormones in general. So melatonin helps you sleep better, and so if you're sleeping better, you probably do fine. Ashu is asking how she can watch this show, the live stream again. T, do you want to tell her how she can watch the live stream?
It will be on our YouTube channel as soon as it's done. You can rewatch the show. It's available
There you
right
go.
under our live stream section, and you can even listen to it as a podcast as well.
She's getting more excitable. This time she gave us 22 seconds before she asked the question again.
Well, she knows that the show finishes in a minute. She wants to make sure she gets it in
That's
there.
right. That's right. Yeah.
Average, oh yeah, fertility showed a high candida. What do you recommend?
Diflucan once a week for 4 weeks is what we do. Lots of probiotics. So that's what we do.
Average amount of eggs I can expect to retrieve at 39 years old. No issues other than tubes tied.
Would need to know your AMH, your weight, things like that. But average, probably between 6 to 12, I think would be average.
What's the first line of treatment when trying to conceive with PCOS, not overweight?
What is the first what of treatment?
First line of treatment.
Oh, letrozole. Yeah, for sure.
Thoughts on metformin for PCOS weight loss?
It's okay. It's not going to do anything by itself, but it's helpful overall.
Pain management for PCOS while trying to conceive.
Pain management? Tylenol?
Too scared to go for a sonohystogram test. Any tips?
Come see us. It's painless. Watch our video. It's not painful at all. Okay. We got to get you to bed. So let me answer these rapid fire. How's that? You good with that?
Okay, sure, go ahead.
Okay, let's go here. I'm 30, not conceive, irregular periods, very long time, or sometime 2-3 months. How I can conceive? Ishrat, you need to see a doctor and you need to get your periods regular. You need to know why your periods are irregular. You probably have PCOS, so you need to be on letrozole. Princess Serenity, what are your recommendations for a 42-year-old woman with DOR, AMH level of 2.5, creating 2-3 eggs per cycle? Recommendations, vitamins, supplements, maybe PRP, maybe. It's a big maybe. Testosterone and human growth hormone priming, DHEAS. Princess Serenity, supplements being taken, CQ10, vitamin D, DHA, DHEA, good, 70, you need 75, not 50. Resveratrol, NMN, metformin, ashwagandha, great. Nothing wrong with those. That's fine. Which is the best selection method for sperm in older men with high DNA damage? MAGS, ICHI, etc. We use ICSI, and we process the sperm first. And if you get a second sperm sample 3 hours after the first, you'll have 80% less DNA damage. How can autoimmune conditions affect egg quality? Oh my God, that's a whole show unto itself. Will antihistamines be detrimental? They're not helpful. You need an immune protocol if you have immune problems. I unfortunately used Lupron Depot prior to egg retrieval and didn't respond to stims. Of course not. Was told Lupron oversuppressed me because of age 38 and DOR. I don't know why you used Lupron before, Taylor. That's not sensible. Okay, we're going to shut the show down, guys, because Tarek has to go to sleep. So, love you all. Have a wonderful, wonderful surgery. Have a wonderful, wonderful week. I'm reading as I'm going off here. And we will see you next week. Are you back next week? Oh, you're back on next week.
I'm back on next week. Yeah, I land at that exact same day.
You won't be doing the show, will you?
I don't think I'll be doing the show, no.
Yeah, I don't think you'll be doing the show either. All right, man. Well, we'll figure something out. Okay, everybody have a good night. T, I love you, brother. I hope you stay safe and stay cool. Stay in the shade.
Yeah, absolutely. Take care.
All right.